In this audio lecture, we're going to be continuing our discussion of conditions that affect urine elimination and focusing specifically on urinary tract infections. All right, so this lecture is going to focus on the urinary tract infections. And so what are urinary tract infections? Well, first of all, they are infections of the urinary tract, right? And that they are extremely common. And most of the time, it's E. coli that is the common culprits. I recently read a book titled Big Chicken, and this book talks about how UTIs are always credited towards being caused by E. coli, right? And they usually blame it on the females, right? So improper hygiene techniques, going to the restroom. Well, turns out a lot of this E. coli is stemming from cross-contamination from food sources, okay? Especially from meat. And so we see E. coli lives, it's a part of our natural biota, and so it lives naturally in our digestive system, in our colon, but it can also accumulate on the skin, and if it gets near the skin, okay, especially in women, this is a problem because of the shorter urethra. We can see that the bacteria start to move up the urethra and enter the urinary system, right? Not all of these are due to the skin accumulation of the E. coli. Okay? Some of them are due to blood-borne mechanisms, but they are much more rare in occurrence to occur that way. So we have innate mechanisms to prevent this bacterial infection. Specifically, we have one-way valves. This is the ureteral opening, okay, from the ureters that are draining into the bladder, and so we have these one-way valves, right? And so urination is a mother's nature cleanser, right? So it clears out any bacteria that are residing in our urinary tract system. Men have prostatic secretions, so these modify the pH of the urethra in preparation for ejaculation. Well, they can also have antimicrobial activity. Okay? And then we have natural immune function of our bodies, right? So we have all these mechanisms to prevent these bacterial infections, but they still occur. So the risk factors for developing urinary tract infections really include being a woman, right? So you have three factors as a woman that are acting against you and favoring the formation of urinary tract infections. First of all, women have shorter urethras. So this decreased distance that the bacteria have to travel is really a hindrance for proper health, right? And it precludes you towards the development of urinary tract infections. Women urinate sitting down, which leads to incomplete bladder emptying. And women may experience increased perineal disruption, right, or tissue irritation from sexual activity, which could lead to an irritation of the urethral lining, and then also lead to this increased infection of the urinary tract. So we see some additional things can cause women urinary tract infections. Tampons, bubble baths, bathing suits, tight-fitting clothes, deodorants, as well as less conservative underwear like thongs and silk underwear. Okay. We see some additional occurrences or causes of these urinary tract infections include benign prostatic hypertrophy. Now, recall that the prostate only exists in men, and so this would be a risk factor for men only. Okay. We could get urinary tract abnormalities from birth, and so the improper development of the urinary tract system, leads to predisposition for urinary tract infections. Immobility, urinary or bladder or bowel incontinence, and so anytime we lose control of our urine or our bowel movements, this can increase the likelihood of bacterial infection because now those bacteria are not being properly cleaned away right away. Okay. renal caliculi, and so this renal caliculi prevents bladder emptying, decreased cognition. So if you aren't aware that you need to go to the restroom. Pregnancy. So we know that pregnancy increases chances of developing a UTI, specifically because you have this little thing inside of you bouncing on your bladder, right? So this baby that is bouncing on a bladder, okay, impairs bladder function, and so well, what might be an increased pressure at some point, the baby will get off, and now the pressure goes away, and the mother goes to the restroom, and she gets incomplete bladder emptying because the pressure was high before over here when the baby was on it, but then when she got up and moved, the baby moved off its spot, and that can decrease the amount of urine excreted. Okay. Well, obviously, if you ever have a immunocompetency disorder, so if you are precluding yourself to developing these bacterial infections, urinary catheterization, as we've talked about before, increases the likelihood that bacteria will grow inside the urinary tract system. Okay. And improper personal hygiene is also a cause. So I know that women need to keep the perineum particularly clean because this could act as a large source of infection. So some manifestations of urinary tract infections, oftentimes they are asymptomatic until they are not, right? And then the symptoms oftentimes include urgency, dysuria, right? So now you get dysuria, you get pain while urinating. Urgency would be talking about really you get this frequent urge to urinate, right? So frequency is another manifestation. Hematuria is going to be blood in the urine, right? So this could be due to an inflammatory event that is either irritating the urethral walls, ureteral walls, or even the kidney. And depending on the kidney, we'll talk about some more. And we can get bacteria, right? So bacteria is going to give off a cloudy appearance to urine, and then also lead to a foul odor of that urine. Right? Symptoms of a urinary tract infection include symptoms just of a generalized infection, so fever, leukocytosis, anything like that is going to respond to an infection normally, okay, is going to present itself here because you have an infection. Diagnosis. In addition to looking at the physical exam, you're going to be collecting a patient history. Okay? You're going to be conducting a urinalysis, which might include looking for white blood cells or bacteria in the urine. Okay. In addition to the urinalysis, you're going to conduct urine culture, so you're actually going to try to grow some bacteria that are in the urine on an agar plates. Okay. Cytoscopy, so you're going to be looking in the urinary tract, looking for any kind of irritants, any kind of inflammation occurring there. Okay. We're going to be doing a CBC, looking for leukocytes. If leukocytes are high, this would be indicative that the individual has a urinary tract infection, right? And then you would use all sorts of imaging techniques, right? So in addition to the cytoscopy, you might use an X-ray, and this would tell you about inflammatory events that are occurring along the urinary system. It may be an MRI, maybe a cytourethriogram. So how are you going to treat urinary tract infection? Well, first and foremost, antibiotics. And you got to take the entire dose of antibiotics. It's not an option. You got to take the entire dose despite what it does to your body. We are going to increase hydration to increase the frequency of urination and increase washing of the bacteria out of the urethral lining. Okay. And we're going to try to avoid irritants like soaps with perfumes in them. We're probably going to try to stick to a more conservative type of underwear. So anything other than cotton really provides an irritation to your urinary tract. Okay. And we'll perform proper perineal hygiene. Right? Perineum is the area between your anus and the vagina or the reproductive structures. Okay. Not delaying urination. The sooner that you get the urge. So if you get the urge, go. So if you hold it back for a while, it could lead to the development and formation of these urinary tract infections. Okay. We need to adequately empty the bladder and then make sure that individuals with catheters are appropriately being cared for. So that is the audio lecture over urinary tract infections.